1. Which adult learning theory emphasizes self-direction and the learner's prior experience as foundational to learning? A. Behaviorism. B. Cognitivism. C. Andragogy. D. Constructivism. 2. When evaluating a new medical assistant's performance, which method best ensures objective assessment? A. Peer observation. B. Self-evaluation. C. Standardized performance checklist. D. Verbal feedback. 3. In curriculum development, which component ensures alignment between instructional activities and learning outcomes? A. Learning preferences. B. Teaching materials. C. Learning objectives. D. Course outline. 4. A mentor notices that a trainee medical assistant struggles with time management. What is the most effective mentoring response? A. Assign additional tasks to improve efficiency. B. Ignore the issue until the next evaluation. C. Recommend time tracking strategies and offer regular check-ins. D. Refer them to another mentor. 5. What is the primary purpose of formative evaluation in a clinical training program? A. Grade the student's final performance. B. Provide ongoing feedback to improve learning. C. Rank learners competitively. D. Eliminate underperforming trainees. 6. Which principle of adult learning suggests that learning should be immediately relevant to the learner's job role? A. Motivation to learn. B. Readiness to learn. C. Orientation to learning. D. Need to know. 7. During a role-play exercise, a clinical mentor observes inappropriate patient communication. What is the best response? A. Note it and bring it up during the final evaluation. B. Publicly correct the trainee during the role play. C. Pause the exercise and provide constructive feedback privately. D. Report the behavior to HR. 8. What document governs compliance with patient privacy in a clinical medical assistant training setting? A. OSHA guidelines. B. FDA regulations. C. HIPAA. D. CDC protocol. 9. Which instructional design model involves stages of analysis, design, development, implementation, and evaluation? A. Bloom's taxonomy. B. ADDIE model. C. Kirkpatrick model. D. Maslow's hierarchy. 10. What is an effective way to foster critical thinking in adult learners during clinical instruction? A. Memorization drills. B. Providing case-based scenarios. C. Distributing lecture notes. D. Encouraging passive observation. 11. How can a mentor best support a medical assistant struggling with interpersonal communication? A. Criticize their tone in front of peers. B. Assign written communication instead. C. Coach using role-playing exercises and debriefing. D. Transfer the trainee to another department. 12. Which type of learning objective focuses on a learner's ability to demonstrate a psychomotor skill? A. Cognitive. B. Behavioral. C. Affective. D. Psychomotor. 13. A curriculum is evaluated and found to lack opportunities for learner self-assessment. This issue most directly affects A. External accreditation. B. Regulatory compliance. C. Adult learner engagement. D. Financial efficiency. 14. Which of the following is an example of summative evaluation? A. Daily quiz feedback. B. End-of-course practical exam. C. Weekly journal entries. D. On-the-spot corrections. 15. What is the best method to assess learning retention in adult clinical trainees? A. Attendance records. B. End-of-shift surveys. C. Simulation with real-time feedback. D. Time-on-task metrics. 16. Which mentoring technique promotes learner autonomy while still offering support? A. Micromanagement. B. Direct instruction. C. Guided discovery. D. Total delegation. 17. In adult learning, the role of the instructor is best described as A. Authoritative director. B. Passive observer. C. Facilitator of knowledge. D. Disciplinarian. 18. A training program's goals are outdated. What is the first step in updating the curriculum? A. Issue a compliance report. B. Conduct a needs analysis. C. Hire new instructors. D. Remove old materials. 19. A clinical instructor gives a pre-test before starting a module. This is an example of A. Criterion-referenced testing. B. Diagnostic assessment. C. Formative evaluation. D. Summative evaluation. 20. Effective feedback for adult learners should be A. Vague and delayed. B. Timely and specific. C. Rare and impersonal. D. Emotional and spontaneous. 21. In the context of regulatory compliance, which agency oversees safety standards in clinical environments? A. NIH. B. CDC. C. OSHA. D. WHO. 22. The primary goal of a mentoring program in clinical education is to A. Reduce hiring costs. B. Increase administrative control. C. Support professional growth and development. D. Monitor task compliance. 23. How should a curriculum developer ensure inclusivity in clinical assistant training? A. Ignore cultural differences. B. Use one-size-fits-all instruction. C. Integrate diverse patient scenarios and learner backgrounds. D. Focus only on standard protocols. 24. Which is an example of an effective domain learning objective? A. Demonstrate proper hand washing. B. Describe types of infections. C. Value the importance of empathy in care. D. Recite patient safety regulations. 25. A medical assistant trainee shows poor infection control practices. The most effective intervention is A. Verbal reprimand during clinical rounds. B. Assign independent research. C. Provide direct coaching and a skills demonstration. D. Wait for them to improve independently. 26. What is a key characteristic of adult learners? A. Learn best through repetition only. B. Prefer passive lectures. C. Bring prior knowledge to new learning. D. Avoid accountability. 27. Which communication technique is essential for delivering difficult feedback to a trainee? A. Deflection. B. Aggressive tone. C. Active listening. D. Interruption. 28. Which strategy enhances learner engagement in clinical instruction? A. Mandated silence during training. B. Multimedia lectures without interaction. C. Problem-based learning. D. Lecture-only formats. 29. What tool ensures curriculum compliance with national standards? A. Hospital feedback. B. Course textbook. C. Accreditation rubrics. D. Attendance reports. 30. Which component is essential in evaluating the effectiveness of mentoring relationships? A. Mentor's credentials. B. Number of mentoring sessions. C. Feedback from mentee. D. Mentor's years of experience. 31. In adult learning, motivation is most influenced by A. Peer competition. B. Relevance to job role. C. Test anxiety. D. Length of program. 32. Which evaluation tool is best for assessing psychomotor skills? A. Written test. B. Simulation checklist. C. Multiple choice exam. D. Peer feedback form. 33. Which is a key principle of mentoring in clinical education? A. Focus solely on technical skill. B. Build trust and mutual respect. C. Provide general guidance only. D. Ignore mentees' goals. 34. When revising a training module, what should be evaluated first? A. Trainee feedback. B. Instructor salary. C. Classroom temperature. D. Brand of supplies used. 35. A clinical mentor encourages a learner to reflect on a patient interaction. This practice supports A. Memorization. B. Reflective learning. C. Timed assessments. D. Compliance monitoring. 36. What is a major barrier to adult learning? A. Desire for autonomy. B. Lack of previous experience. C. Irrelevant content. D. High expectations. 37. Which communication practice promotes a supportive clinical learning environment? A. Dismissive responses. B. Open-ended questioning. C. Passive-aggressive tone. D. Sarcasm. 38. A compliance audit reveals missing documentation in training records. The next best step is to A. Discipline the trainer. B. Document all missing information. C. Develop a remediation plan. D. Ignore the audit. 39. What is the purpose of using learning contracts with adult learners? A. Limit flexibility. B. Enforce punitive consequences. C. Promote accountability and shared goals. D. Replace formal evaluations. 40. An effective method to evaluate curriculum impact is to A. Ask learners for anonymous feedback. B. Increase the number of tests. C. Reduce content complexity. D. Eliminate elective topics. 41. Which principle helps align training goals with job performance outcomes? A. Instructor-led pacing. B. Learner choice. C. Competency-based education. D. Lecture-style delivery. 42. A medical assistant reports uncertainty about scope of practice. The mentor should A. Ignore the concern. B. Direct them to current state regulations. C. Refer the question to HR. D. Reassign the task. 43. Which is a valid reason to update a clinical training curriculum? A. Increased budget. B. Instructor fatigue. C. Revised national certification standards. D. Shorter semesters. 44. In evaluation methods, which technique promotes immediate corrective feedback? A. Weekly surveys. B. Peer discussion groups. C. Simulation exercises. D. End of semester tests. 45. What quality must a clinical mentor demonstrate consistently? A. Assertive dominance. B. Availability and guidance. C. Distance and objectivity. D. Strict adherence to deadlines. 46. Which federal regulation mandates proper disposal of biohazardous waste in training settings? A. EPA Clean Air Act. B. OSHA Bloodborne Pathogens Standard. C. HIPAA Privacy Rule. D. Title IX. 47. What enhances trust in a mentoring relationship? A. Withholding feedback. B. Shared decision-making. C. Frequent criticism. D. Structured isolation. 48. A reflective journal assignment supports which aspect of adult learning? A. Kinesthetic learning. B. Assessment scores. C. Metacognition. D. Peer competition. 49. The best time to introduce summative evaluation is A. Mid-training. B. After foundational content. C. After remediation. D. At the end of the training program. 50. What is a common sign of disengagement in adult clinical learners? A. High performance scores. B. Excessive participation. C. Avoidance of hands-on tasks. D. Frequent questioning. RMA Clinical Medical Assisting Test. The RMA Clinical Medical Assisting Test, administered by the American Medical Technologists AMT, is a certification exam designed to assess the knowledge and clinical competencies required for entry-level medical assistants. It evaluates a candidate's ability to perform essential duties in clinical settings, including patient care, diagnostic testing, pharmacology, and medical procedures. The test also includes components on communication, patient education, infection control, regulatory compliance, and administrative tasks. It is structured to reflect real-world scenarios and emphasizes safety, professionalism, and ethical practice. Successfully passing the exam demonstrates that the candidate is qualified to support physicians and healthcare teams in delivering quality patient care. Here are the top 5 beneficial uses of the sample exam. 1. Professional certification. Passing the RMA Clinical Medical Assisting Test grants formal recognition from the American medical technologists, enhancing a candidate's credibility and validating their clinical competence. 2. Employment opportunities. Certification increases a candidate's appeal to employers, opening doors to more job opportunities in physicians' offices, clinics, and healthcare facilities. 3. Standardized skill assessment. The exam offers a structured evaluation of key clinical and administrative skills, ensuring that certified medical assistants meet industry standards and regulatory requirements. 4. Career advancement. Holding an RMA credential may lead to promotions, higher wages, and specialized roles within healthcare teams. 5. Patient care quality. Certified medical assistants contribute to safer, more efficient patient care by applying standardized practices in clinical procedures and communication.